Hi, my name is Rebecca Carver, and today I'm going to be telling you about why it's so important for you to follow the rules of the CDC during a pandemic. Now, as of Thursday, April 2nd, 2020, there have been 1,013,028 worldwide cases of coronavirus. And as of today, 8 days from that, the jump has been drastic. There are now 1,684,281 cases worldwide. In Tennessee alone, as of Thursday, April 2nd, there have been 2,845 cases and 32 deaths. And I want you to understand why it is essential for you to follow the rules from the CDC and state government during the pandemic. On March 11, 2020, the World Health Organization, better known as WHO, declared COVID-19 a pandemic. And I'm very credible for this because I quarantined myself for a week when I came back from spring break to make sure I showed no symptoms of the virus. Now, according to Merriam-Webster Dictionary, COVID-19 is defined as a mild to severe respiratory illness that is caused by coronavirus, which a coronavirus itself is a severe acute respiratory syndrome coronavirus 2 of the genus Beta coronavirus. Now, this virus itself is transmitted directly by contact with infectious materials such as respiratory droplets and is characterized especially by fever, cough, and shortness of breath and may progress to pneumonia and respiratory failure. I'm going to tell you about three main things. 1, people are not following the rules of the CDC, which is a huge problem. 2, people under the age of 20 are not largely at risk, so why should I follow them anyway? But the overall solution, number 3, is people need to follow the recommendations of the CDC and the state government during this pandemic that we're experiencing now. Due to people not taking this pandemic seriously, the United States of America has suffered the most. As of Friday, April 3rd, 2020, the U.S. had reported that we have had 277,467 coronavirus cases. People are not following the rules of the CDC and the state government. Therefore, our numbers are skyrocketing, which is bringing the U.S. to the top of the list of the countries that have the most COVID-19 cases, which to me is very ironic, seeing how it did not start here in the United States. It started in China. Now, according to U.S. News, Governor Lee in Tennessee issued a statewide safer-at-home order. It was originally a recommendation, so it's why it was so important why all newscasts broadcasted it, because he issued it to be an order now for everyone to follow that order on that Monday to help stem the rapid spread of coronavirus, mandating closure of all non-essential businesses while urging residents to stay at home whenever possible for the next 2 weeks, which would have been made the safer home order in April 14th in Tennessee. According to the Tennessee Department of Health, there have been a total of 3,067 positive cases of COVID-19 in Tennessee alone. Sorry about that. According to U.S. News again, as of Monday, Tennessee's health agency has confirmed more than 1,800 cases and at least 13 deaths, spreading across the 95 counties in Tennessee. Now, as of Friday, April 3rd, 2020, the age ranges has confirmed from 0 to 80, and there's a chart on tennessee.gov/health showing that. And the highest number of age ranges was 693, which that age range was 21 to 30 years of age. Now, but what if I'm perfectly good health? Do I still have to stay at home and follow the rules of the CDC and my governor? That is a question many people have asked themselves daily, not only in Tennessee, but the U.S. alone. Now, people under the age are not largely at risk. I'm a perfectly healthy 19-year-old girl. I have a great immune system, no history of underlying medical conditions. I don't have asthma or anything wrong with my lungs, so I don't have to follow the rules, right? Right? According to the CDC, COVID-19 is a new disease and there is limited information regarding risk. So, with that, based on currently available information, clinical expertise, older adults and people of any age who have serious underlying medical conditions might be at higher risk for severe illness from COVID-19. Based on what we know, these are high risk. People are 65 years of age and older and living in a nursing home and long-term care facility. That's not me, so I'm not at high risk. Okay. Now, with that, tons of people are going on spring break trips, so I'm okay to go out, shop, and have fun. With that, COVID-19 didn't keep beach people away from going to Florida. It didn't keep people from coming here to Tennessee and Gatlinburg and Pigeon Forge. I know this because my brother works at a trampoline park in Pigeon Forge. And that's why it's so important to be part of the solution, because all those things I just said are wrong. You are at risk no matter what the age you are. And it doesn't matter if you have a great immune system, you have no medical health conditions, you still are at risk. This is why it's so important to be part of the solution. People need to follow the rules of the CDC. By following the recommendations, it keeps you and everyone around you safe and healthy. By following the recommendations, we can stop the spread of this virus. Knowing that the virus spreads can be crucial when trying to prevent from getting sick. According to the CDC, there is currently no vaccine to prevent the coronavirus disease 2019, COVID-19. The virus is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet. The respiratory droplets produced with an infected person coughs, sneezes, or talks. These droplets can land in mouths, noses, or people nearby and possibly be inhaled into the lungs. Some recent studies have suggested COVID-19 may spread by people who are not showing symptoms. Now, with that, there are multiple steps, factors, and precautions everyone should take into preventing the spread of COVID-19. Now, these steps consist of cleaning your hands often, covering your mouth and nose with a cloth face cover when around others, cover coughs and sneezes, clean and disinfect, and lastly, avoid close contact. Example, stay at home as much as possible and put distance between yourself and others. Overall, this virus is spreading like wildfire all over the U.S., and it's up to us to keep ourselves safe and follow the CDC guidelines and eradicate this virus. Today I told you about why people aren't following the rules of the CDC, which is a huge problem, but people under the age are at high risk. Wrong. And people need to follow the recommendations of the CDC and their state governor. If we do not follow the rules, COVID-19 will not get any better anytime soon.